I'd like to take a minute to talk about some of the various techniques used for facelift surgery. Now, when I talk about facelift surgery, it really encompasses essentially everything from kind of the lateral part of the brow down to the collarbone. So it lifts everything. I guess the more appropriate term would be a temple cheek neck lift is essentially what this does, but it's usually termed a facelift. Now, there's several different types of facelifts. The first is what's called an imbrication facelift or a purse string facelift. I'll describe that in a second. The second is a SMAS lift. And the third that I'm an advocate for is what's called a deep plane facelift. Now, I've used this diagram and I've taken a lot of my information of this from a doctor named Dr. Mike Nyack in St. Louis. Fantastic doctor, recommend that you follow him. But you can see sort of my rendition of what he discussed with this. But I'm using this diagram to illustrate the different layers of the face. Now, with any surgery, layers is very, very important. When the body develops, we develop into layers. And so really every aspect of any type of surgery really is finding the layers, making sure you know what you're at, and getting into safe locations. So this outer layer here, so this is the right side of the face, this is the ear, the eye, and this is the jawline. This first layer is the skin layer. And you can see that as I reflect up this skin layer, you can see this yellow layer, which represents the SMAS layer. SMAS stands for superficial musculoaponeurotic system. It's a connective tissue layer underneath the skin that's generally worked on when you're doing any type of facelift. And then underneath the SMAS layer are facial nerves. So these white strings represent the branches of the 7th cranial nerve, also known as the facial nerve. This is what moves your face. So if you were to cut or injure any one of these nerves, it would potentially cause weakness on that side of the face or even up to a Bell's palsy. So this very important part of facelift surgery is just knowing where that nerve is, making sure that you can take good care of it. Okay, these other push pins, so these blue pins represent what are called osteocutaneous ligaments. And these are ligaments that go from the bone and extend all the way out to the skin layer. So these are zygomaticocutaneous ligaments, mandibulocutaneous ligaments, and parotocutaneous ligaments. Now, in my opinion, very important aspect of facelifting is making sure that you go through those ligaments completely and free them up. We'll talk all about that in just a second. Okay, so first type of facelift is what's called an imbrication facelift. And essentially what they do when they're imbricating the SMAS is they lift just the skin layer up into the subcutaneous plane, and then they take a suture, loop it down into the SMAS in a purse string fashion. So it makes a loop, and then they tighten it up, and it cinches on the SMAS, pulls up the cheek, pulls up the midface, tightens up the jowl. Now again, this is a lot of named facelifts like the Swift lift or the Lifestyle lift. These are purse string facelifts where they're done with a purse string that essentially just tightens the SMAS. In my opinion, the downside of these facelifts is that number one, you're not going through these ligaments. And so you're pulling against the ligaments. Eventually they win. The suture's going to lose, the ligaments are going to win. And so you can get some nice results for a short period of time, maybe 6 months to a year, and then the ligaments win and it pulls everything back down again. Okay, second type of facelift is what's called a SMAS lift. And what happens with a SMAS lift is they lift the skin layer and then they lift up the SMAS layer, but just a short flap. So they're lifting up basically to the edge of the parotid gland, which is a salivary gland that sits right in front of the ear. And then they take that and they tighten that up as much as they can. Now, again, you can get some decent results, but the main problem with the SMAS lift is that you're not going through these ligaments. And so you just don't have the ability to move the face and make sure that you can get into the glide plane and really pull everything back. Okay, so that's a SMAS lift. And again, it exposes the parotid gland, but really protects the nerves, which is the main reason why people do a SMAS lift, is they don't want to get out into the danger territory where they're too close to the facial nerve. Okay, deep plane facelift, what is it? A deep plane facelift takes that SMAS layer, elevates the SMAS, but then goes deep and far out away from the parotid gland in what's called the glide plane. The glide plane is a natural plane that sits between the SMAS layer and the parotomasseteric fascia. I've represented this parotomasseteric fascia with this little thin piece of saran wrap, and the reason I use that is because it is truly a very thin layer that covers the facial nerve. It protects the nerve, but it is so thin that it's easy to get through it. And again, that's why people don't want to do a deep plane facelift, is because they fear the nerve. So you get out into the deep plane, you come through these ligaments. And when you go through those ligaments, you expose parts of the facial nerve, but again, it allows mobility to where they're holding the face down, and it allows you to pull everything up nice and tight. So that's a deep plane facelift. Now, what are the drawbacks of a deep plane facelift? In my mind, there's almost no drawbacks. I think this is absolutely the superior way to do a facelift. It gives you longevity, gives a very, very natural look where it just repositions where the tissue used to be. So it literally makes you look like you're 10, 15, up to 20 years younger with a deep plane facelift. The permanence of it, so longevity, 10, 15 years, stays really nice and tight, gradually descends very slowly over many, many years, but you just get a lot of durability out of it. Unlike a purse string facelift that are relatively short-lived, they just last for a long, long time. The reason why not everybody does a deep plane facelift is they're just not familiar with the facial nerve anatomy. They don't operate in the face often enough. So you'll have various types of training in some people who don't do deep plane facelifts. And again, that's the fear, is they don't want to cause injury to the nerve. Now, just because there's potential of injuring the nerve does not mean it's going to be injured. Again, every surgery has risks, and so you just have to make sure you know where you're at, that you're doing things safely, and that you can do it safely on everybody. So it doesn't mean that you shouldn't have this type of procedure. It just means you have to choose somebody who knows how to do this operation, can do it well, and can give you the right results safely. Now, we call this territory out here tiger territory, because again, there's this very thin layer of cellophane. The parotid gland that covers the facial nerve is gone once you get out into the deep plane, and there's this very thin protomasseteric fascia that's covering the facial nerve only. So being very gentle and delicate and making sure that there's no damage that happens to that nerve is very, very important. And in the right hands, this is absolutely possible. I've done hundreds and hundreds and hundreds of deep planes facelifts with no incidence of facial nerve damage. That again allows you mobility, so you can pull everything up, make sure you get effacement of some of the folds in your face that give you the result that someone's looking for, and what makes you look older, and the reasons why people are coming to see us for facelift. So it allows mobility to pull everything up, and it allows a zero tension closure. So when you're closing everything, the tension is on the mobility. So it's moving everything up, pulling on the SMAS layer. That's where there's tension. On the skin, you're basically just laying the skin down and sewing it into place. So there's zero tension. There's very little tension on the SMAS because we've freed it up, but there's no tension on the skin when we close that down. So the scars look really nice. Even within a short period of time, the scars look fantastic, heal beautifully. A couple things, aspects of a facelift that are unique in my practice is we do what's called a rapid recovery mini lift. Now what this means is that we just don't elevate very much of the subcutaneous plane. So we elevate very little in the subcutaneous plane. We elevate far in the deep plane. So you're going all the way out right on top of the nerves in the deep plane, but the elevation that you do in the subcutaneous plane is limited. That allows for mobility of the SMAS layer and tightening of the face, but the bruising that you get is minimal. And the reason people bruise is subcutaneous elevation. So if you extend and elevate deep in the subcutaneous plane on top of the SMAS layer, a lot of bruising, a lot of swelling. The amount of bruising that you get with very limited subcutaneous undermining is small, and this allows for a more rapid recovery with all of the benefits that you get from a deep plane facelift.